My name's Louise Prouse, and I'm a parent of a boy with AHC. He's now 23 years old.
Okay.
And I've been involved with AHC since he was 12 months old. The diagnosis came about only after a year. When he was 3 months old, went to see a consultant who was doing a clinic locally and was given a diagnosis of quadriplegic spastic cerebral palsy with epilepsy. Go away and think about that one. And then went back at 9 months old, and they said, no, it's obviously not a spastic cerebral palsy, it's athetoid cerebral palsy. But I'd, in the meantime, bought a book on both and couldn't find anything except, interestingly, what they said earlier about Todd's paralysis. That was the only thing I could find that was like it. And then consultant at the hospital said, I think I know what it might be, and he referred us up to Professor Neville in Great Ormond Street, and that's how we found out what it was. But going back slightly with Toby's birth, obviously he was born very quickly and was a very big baby, and when he was over the first night, they said, oh, he's got something wrong with his breathing, and we'll take him to the special care baby unit to see. And then they said that he jittered, and he was in there for about a week and then discharged on phenobarbital, which is a very strong anticonvulsant. And when I took him home, I knew there wasn't something quite right because I had 3 older boys. But when the health visitor came round, he was sat on my lap and his leg twitched, and she didn't like the look of that, which is why we went into hospital at a month old, and they did all the tests and there was nothing, they couldn't find anything. And then we saw this, and then at 3 months we saw this consultant who then gave this diagnosis, the wrong diagnosis, obviously. So, but after finding out about it, then I spent the second year trying to find everything out about it. So, and that was when I met with Jill, because they gave me the name of the support group, and went on from there. AHC's very complicated. It's not an easy thing to describe or to describe to anybody for the first time, because when somebody has to see that your child do have an episode, and when they see your child have an episode, they automatically say, he's having a fit. That's the first thing people say. So to have to explain that they're not like it all the time, people don't understand that at all. They don't. So I would say alternating hemiplegia presents with weaknesses to one side or the other, a bit like somebody's had a stroke. That's how I describe it to people. I say it's a little bit like somebody's had a stroke, that they lose the power on one side or the other, and that explains the alternating bit. The hemiplegia, that it affects one side or the other, and of childhood is just a title that's given to it, and it's not just of childhood, mine says, because he's now 23. So, but there is no alternating hemiplegia of adulthood. Toby's always been on flunarizine. That has been the key drug all the way along the line. We've had difficulties getting that sometimes because it always came from abroad. We used to have it in quite big bulk, always picked it up from but managed always to pick it up from the local hospital. So didn't really have a problem with getting supplies of that. He's been on every anticonvulsant you can possibly name. Some really horrible ones that, obviously weren't working. He's currently on topiramate. He was having clonazepam as a rescue med, but he was having, while he was a baby and a small child, he would always have Valium, and it was always rectal Valium, and that was the only way that, we could get the episodes to stop. And that's very, very undignified and very, horrible for the young person. But then we went on to midazolam and then buccal midazolam, and in fact the clonazepam hasn't actually worked very well for Toby, so he's back on buccal midazolam now for his rescue meds. He has a hyoscine patch for the saliva, excess salivation, and he wears that all the time, has one of those on. They're changed every 24 hours, aren't they? He doesn't dribble as much, but he still does have wet patches here, so, but through all the medications, his teeth are terrible. He's got a very, very protruding front gum, and his teeth are like tombstones. They can't do anything about it. He also has really poor eyesight. Very used to take him to the swimming pool. That was a no-no. He'd be fine for the first 5 or 10 minutes, and then all the noise and the lights and the loudness, the water and children's, that would set him off. The seaside or anywhere exciting, the excitement sets him off. The excitement of going to places, parties. I'm not convinced by that, because he used to quite like aromatherapy type stuff. So I'm not sure whether strong smells set him off or not, really. Because he used to have like foot massages and things with oils and that, and he used to quite like that. His mobility is on the poorer end. He needs a wheelchair for outdoor use. He can walk a few steps. Interestingly, looking at the list of things, the Parkinsonism type things, I would say, because I look after adults. I'm a nurse, and I look after elderly people, and to see with the Parkinson's type thing, the rigidity, the way the Parkinson's people move, I would say he has that kind of things going on. He uses a standing frame, but he can only have short periods in that. He, as a younger person, as a child, he could walk independently. He could never get up from ground level, though. He could never go from sitting into crawl. He always had to go over to something and pull himself up. So he could never get up independently off the floor, ever. He's quite thin for his age. He's not got any muscle tone. His legs and his arms are quite thin. He holds his hand sometimes a bit like this. when he's in an episode, his legs will be like that. His facial features he's obviously matured through puberty, but he has very poor skin, quite a lot of acne on his skin. He also gets sebaceous things in his ears, look like little white heads in his ears. So his skin is very poor, but he's quite strong in other ways. So although his muscle tone is low, he's quite tough, and quite strong. And if you had to hold him and restrain him from doing anything, like hurting himself or if he was going to fall off something and you went to hold him, you'd have to use quite a lot of strength to hold him. He's about 5. He's not quite as tall as me. I'm 5'6", so I would say he's about 5'4", and yet he's 23. And yet my other sons are not. Well, I've only got one son that's over 6 foot. The others are 5'9", 5'10". We're not particularly big built. But he's always been underweight for his age and undersized. He went to a normal play group and what they call an opportunity play group, which was a play group for children with special needs when he was up to the age of school age, up to the age of 4. And then after that, he did go to a special school. I remember a phrase very clearly, the woman saying to me, because I wanted him to go to the normal school with support, but 20 years ago you had to really fight for support assistance for children like that. So I remember her saying to me, would you want him to go to an ordinary school and be sat in the corner and there's dear little Toby, but he's not learning anything? Or do you want him to go to a special school where they will teach him in a different way? So a horrible decision to have to make, but I made that decision and he did go there. And he could have stayed there until he was 19. But I didn't want him to stay because I felt the year between 18 and 19 was a very, what I call a woolly year. And where they still wouldn't have made a final decision. So I started the process very early at 16 to plan for what was going to happen to him at 18. But yeah, he did go there, and I had a lot of help. I had respite care. He'd go to a residential place for respite care to give us a break. But he also did an awful lot as a family. We took him to Disney World, and when he was about 4, in Florida, and he came on other holidays and that with us, and we did a lot with him. I would say he has some sort of episode of some sort on a daily basis, whether it just be that his hand goes a bit for a minute and comes back. You have to remember that I don't look after him now on a daily basis, so it's very difficult for me to give a really current, up-to-date picture of how he is on a daily basis. But going back from when I had him at home, the episodes could be, like we were talking about earlier, could be momentary. Certainly when he was a baby, I describe him as a baby and as he was growing up. From a tiny baby, he would start off like this. His arm would go up like that, and he'd be stuck like that as a tiny baby. And then you'd physically see it change to the other side like that. And he'd be crying all the time, and that's as a tiny, tiny baby. And then as he grew, obviously it would be more like they told us more right-sided than left, but he would lose the muscle power, but generally one side or the other or both. As he's grown, it's changed as he's grown and gone, and as puberty's come on, the patterns have altered, and now he does, but they don't ring me very often, that he's had to have the rescue meds. They ring me every time he has to have the rescue med. It's their protocol to do that, which is very good. But I would say probably on average, once a month, once to 6 weeks, will he have a really, really bad time when they've had to give the rescue meds. The rest of the time, he might become very tired and not be able to do any more and function anymore when they put him to bed. He does go to bed quite early and sleeps most of the night, although it's quite fitful sometimes. But very rarely has episodes at night, and as we all know, sleep relieves it. So if they're in any doubt, they'll let him go and lie in his room and lie on the bed and have a rest, and sometimes he'll come back to life then and come back out and join in with the rest of what's going on. Well, I think my best message to other people is that you have to optimise what you've got now. However old your child is and however able they are, or not able they are, but mostly however able they are, you have to enjoy that for what it is. I was terribly guilty to begin with of thinking, what's it going to be like when he's older? What's it going to be like when he's an adult? We didn't know of many adults with it then. And I'd like to think now that with Toby being as he is, and yes, there were some difficult times, but we've not had any major things really with him. He has continued, he's survived all these horrendous fits and these horrendous episodes, and where you think, how on earth can your heart stand anymore? How on earth can your body stand anymore? But he's come out the other side. He's, and he is enjoying life. He goes out, he goes away, he goes on holiday, he does all sorts of things. So my message would be now that the times that you've got and the good times, then make the most of them. Feed them when when you've got the good times, and get every bit of wonderful stuff into them then. And then when they're having their bad times, hopefully they'll come back from those a bit quicker the next time, and then I wish I'd had more support. The support now, the support network with social networking, and that sort of thing is very, very good. And the research thing as well. It's not for me. The genetic side of things, I feel, even if they found some magic pill or injection that sorts it all out, would it make any difference for Toby, and would it make any difference for the 23 years of how he's been? So I'm very interested in it, but it's not something that I particularly want to participate in, but that's an individual thought,